Hello, I'm Peter Naish and I'm the President of the British Society of Clinical and Academic Hypnosis. We call it BSCAH for short. As you will guess from our title, we're here for the medical side of hypnosis and also the academic research, and that latter is me. But let me introduce my colleague who does the medical side.
Hello, I'm Grahame Smith, I'm chair of the organisation, and I have a GP background and been interested in hypnosis for many years. I'm very much involved with training all other healthcare professionals to be able to use hypnosis and its wonderful techniques of communicating with people, partly on an everyday basis, informally, and sometimes in a more formal setting.
I think it's perhaps important to point out that we exist in a very formal, strict, correct way of doing it, sense. So in other words, when it's medical, we're here to train medical professionals only and allied professions. We don't train people with no kind of formal medical therapeutic background. And similarly, on the research side, we're open for membership for people who have degrees and can legitimately be studying hypnosis, researching hypnosis in universities. We're anxious for the public to dispel any notion that there's something magical about hypnosis. It's a real science and there are explanations for what happens. And similarly then, on the clinical side, there are tried and trusted techniques. We do it very ethically so as not to cause any problems, and we get very good results. And if you want to expand on any of these results,
I mean, in the training of other professionals, we very much are teaching people to augment what they do anyway in their profession to make things that they do more effective. And for me, hypnosis, essentially, it's a purposeful shift of attention in which the mind is more receptive to ideas, which we hope are positive ideas and suggestions, and some self-discovery for the patient. It's very useful for a huge range of conditions. You can argue that every health professional has a place to use related techniques in their work. For example, in pain, in irritable bowel, and all sorts of other disorders, skin disorders, anxiety, mild to, in my case, in general practice, mild to moderate psychiatric symptoms and so forth, especially anxiety and fears and things.
very good for phobias.
Yes,
very good.
Absolutely. And there's very good kind of hard evidence, isn't there?
Yes,
as well?
there is.
Mm-hmm.
And of course, all these good things that we try to get people to do, we run training courses. And if you'd like to look on our website, there you'll find the dates of our different courses, and we'd be delighted if you signed up.
Absolutely.